So good afternoon everyone, and I'd just like to be the first on behalf of the SAPHIRE consortium to welcome everyone to Belfast, and we've done our very best and put on some lovely weather for you, and you know how our weather has a pretty poor reputation, but I can assure you it's like this every single day. We just don't want to be overrun with people wanting to live here. So my name's Janice Bailie. I'm Assistant Director of R&D Division in the Public Health Agency, and we're one of the partners in the SAPHIRE consortium. And just in case anybody doesn't know what the acronym SAPHIRE stands for, it's securing the adoption of personalised health in regions. So we're all about regions. We're not about countries only, we're all about regions. And regions are the powerhouses of Europe, so we've got that well indoctrinated into us, no matter what happens in the dealings that are going on elsewhere, which we won't talk about today too much, hopefully. So I'm just going to give you a very, very brief outline of the Sapphire Project itself and the consortium, and then just tell you a bit about how the workshop's going to run today. We've got 9 representatives from 9 regions across Europe today, so we're delighted to have such a good turnout, and hope you really enjoy your visit to Belfast. So first of all, just to give you the aim of the SAPHIRE consortium and project. This is Horizon 2020 funded project, and the aim of this is to structure the application of personalised medicine at regional level by establishing and supporting networking between regions, hence our networking events, with a particular focus on remote and or sparsely populated regions. We've got a few sparsely populated regions in Northern Ireland, so we know a little bit about that ourselves. And we want to link all the regions together and build collaborations harbouring critical mass of medical and precision medicine expertise while taking into account broader socio-economic and cultural aspects. So we're not trying to do very much really, but that's the aim of the SAPHIRE project. So SAPHIRE consortium consists of 4 partners. The lead partner is our colleagues from Flanders. Anyone show who you are there? Colleagues from Flanders from the Department of Economy, Science and Innovation. Then we have our colleagues from EIT Health Innostars. Who are they? Over there, and then we have colleagues from Euro Bioforum as well. So everybody's here today, and ourselves in the Public Health Agency. So that's me and Ian and Sorka, really. So we've got 5 work packages, and you can see just here the description, and each of the partners has responsibility for some parts of the project. Ourselves in Public Health Agency, we share Work Package 4 with EIT Innostars, and Work Package 5 is our responsibility, which is communication and dissemination and building this platform together between us all to share our knowledge and learning about personalised health across Europe. So it's quite difficult to get a single definition of personalised medicine or personalised health, but we in the consortium agree that we are defining it in the absolute broadest sense possible. So it's not just about drugs, it's right across the whole spectrum of medicine through health and prevention as well. So you can read what it says on the slide, but essentially we're very keen to work towards the provision of tailored and personalised health provision and treatment for all citizens that is specific to the person. And you hear this saying, the right treatment for the right person at the right time, and that's really what we strive towards. So why focus on regions? Well, as I said, there are regions are now being seen as the powerhouses of Europe, and we are one of a number of coordination and support actions which are underpinning the functions of ICPERMED. And that ICPERMED action plan addresses actions at national as well as regional level. So that means that we are able to discuss with other regions and contribute into the ICPERMED action plan, bringing the agendas together and enabling coordination and alignment from both national and regional contributors. So we have specific challenges, which are different authority levels, different levels of innovation across Europe, regions with some special needs, and as I mentioned before, remote and sparsely populated regions as well. So the project itself has aims, a series of objectives. So we have observe, and we're currently working our way through a mapping exercise that would look at specific regional needs, and we've already had a workshop focused on identifying regional needs and taking the different levels of personalised health maturity into account. And I'm sure everybody has an idea of where they feel that their region is in terms of the innovation and adoption of personalised health. And we will be focusing on linking remote and sparsely populated regions to regions that might be more advanced in personalised health. And that's not to say that some of the remote and sparsely populated regions might not have plenty to tell those of us who feel we've got a lot more to bring. And also then to develop a toolbox for services and support that will help regions to identify joint initiatives that they can work on together in the implementation of personalised health. We're also developing, and this is part of it, we're developing a network that would include regional policy and decision makers, opinion leaders, regulatory agencies, regional development agencies, cluster organisations, patient organisations, regional knowledge institutions and healthcare providers. So we want to bring everyone on board with this project as far as we possibly can, because it certainly isn't something that would be trivial or could be done without all those contributors. And we feel that that will allow us to share the strengths and the needs and barriers across regions, so that we are able to coordinate the information that should be provided to European policymakers who aren't particularly at the moment don't feel that they actually have a real idea of what's going on across all the different parts of Europe. And we hope that this will help to enable a collaborative approach to developing personalised health in regions. Support actions will be undertaken to enable inter-regional collaborations, and we also, of course, none of this will happen without funding, so we're also interested in identifying opportunities for financing or investment by the Framework Programme, the Structural Funds or the Investment Bank. And we'll also be aligning, and those of you who are aware of this, the regional smart specialisation initiatives that are also focused on personalised health. That's a very whistle-stop tour, but hopefully you'll learn a bit more as we go through the conversations today. The format of the workshop today, we have some presentations from our 9 regional representatives. We've been indulged with being allowed to have the keynote from Northern Ireland and our introductions, but everyone in the different regions, we have either 1 or 2 speakers from the different regions, and we've asked them all to cover policy in personalised health and or a best practice example from their region, and to see, hopefully help us see what barriers they've overcome in implementation of personalised health in their region. And hopefully we've got time for 5 minutes questions and answers after each presentation. So today the highlights we're going to be kicking off with Scotland. We've got Southern Denmark, Ireland, Flanders and the autonomous province of Trento. So delighted that all of you have been able to come. Tomorrow we have 4 regions: Extremadura, Västergötland, Podlaskie and East Netherlands. So I'm really looking forward to the programme and hearing what everyone has to say. And then we also have scheduled some time in for some roundtable discussions later on today. And we have 3 areas that we'd like you to think about, and these are listed here, and we'll put them up later. We're going to have 10 minutes on each of those questions for everyone in the room. Will be asked to think about these and put forward their ideas. And then at the end we'll have a roundup, hopefully, where we look at anything else that we might also want to consider or that we might have forgotten. So you know that we'll want to have some outcomes from our workshop today. So for those of you who are here from the regions, it's your opportunity to showcase your innovations and your region and where you are with personalised health in your region. We hope that through the conversations and presentations that we have today, this will help everyone to generate new ideas for our regions and be able to share our practices with each other. Of course, in a room like this, the good thing that happens, and we hope that it just happens, is that collaborations can be created, new networks, new partnerships, new acquaintances and friends, and that we, at the end of our whole project, that we are able to develop a set of recommendations for best practice in personalised health. So we will provide you feedback after the workshop. And we'll also, you may have noticed at the back of the room, our cameraman who's going to be filming the presentations, and everything, all the content of today's workshop will be available on the SAPHIRE website very soon. So that's all that I have to say as by way of introduction. And first of all, our first guest this morning, I'd like to welcome my colleague, Professor Ian Young, who's Director of R&D for Health and Social Care in Northern Ireland and Chief Scientific Advisor to the Chief Medical Officer in the Department of Health. So welcome, Ian.